I'm Dr. Stewart. I'm a clinical psychologist.
And I'm Dr. Emily O'Leary, clinical psychologist, and we're the directors of Mood Disorders Clinic. We decided to put together a couple of videos because we are really passionate about helping people get to therapy and making sure that they get the therapy that they deserve and need. And one of the hot topics, I think, for us is that perception, isn't it, that you only go to therapy when you're kind of really bad, really unwell, and only then do you deserve to go to therapy.
Or are severe enough or in crisis, and that's the only time that you need to present for therapy.
So what do you do when a client asks you when you need to go to therapy? Like, at what point? What do you say to them?
I talk about a number of things. Obviously, if they're actually in crisis or really struggling, well, of course you want to come in and actually get some help with that sort of stuff. But equally, I think it's so important to present almost at preventative stages. So if you're feeling like there is something that particularly bothers you, or you struggle with things, even in phases in your life, but maybe you think it's not bad enough to actually need someone else's help. I think those are exactly the times that you should ask someone else for help. Why not? Because we always check in with GPs for all sorts of reasons. We check in with our health physically, we do exercise, we do all sorts of things. Why can't we do a brain check with a psychologist whenever you
brain
feel like
check, that's cool. Because that perception of you have to be really bad, and also the perception of therapists. Do you know what I mean? Like, we're going to sit there and we're going to help you through this really difficult time. And that may be the case.
Sure.
But equally, it might just be that we're going to help you through this time that you're struggling a little bit. You know, you don't have to be super unwell. And I think we've talked about this before, that a lot of times in therapy, people come because they're treading water in life.
It's that blah thing we talked about. Life's a bit blah. It's not bad enough for me to do anything about it.
That's right.
But nothing's really going super well. Well, then aren't those the times that you should seek out the help of someone that actually has the expertise and the experience to work with the mind and the brain and how that signals everything else that we do, behavior, thoughts, feelings, where we can make it better. Why not make it better?
And I think, in a way it is, we sometimes talk about, a diagnosis of blandness or blandness. and I think it's so important for people when they are feeling like that to reach out to others and, reach out to a psychologist, and it doesn't have to be us, even though we are super awesome. But to kind of go, hey, I'm just not getting the most out of my life that I want.
Exactly.
And I'm stuck, because how often do we hear that in therapy? Like, I'm stuck. The problem is, though, there's always a trade-off, isn't there, with stuckness. And it's kind of like a universal condition in that, if you're stuck, you kind of know where you need to go. You might get psychologist help to try and move you there, but there's always a trade-off that you're going to need to put yourself in some uncomfortable kind of positions. You're going to need to be uncomfortable. You're going to need to feel some degree of distress. And I suppose that's where we can come in, and that's where we can do some good work.
Absolutely.
What's your number one tip, strategy, thing you say to a person when they go, that sounds really good, I just don't know if I'm strong enough to do that, or I just don't know if I can do that?
Actually, this may sound really cheesy, but...
Go cheesy.
Okay, isn't that sort of the point of seeing a psychologist, is let's work at it together? If you can't, then let me help you. Let us work together to, make small steps that are doable, or figure out what are the smaller things that still are significant enough that some change is happening that then fosters more and more change, and then it becomes easier and easier. It doesn't need to be, okay, now I need to solve this massive thing right away. It's, let me recognize that I have the capabilities to do even one small thing and then build from there.
We're going to walk along with you, but essentially it needs to be more important to you to reach that goal than avoid feeling uncomfortable.
Exactly.
I like it.
Yeah.
Golden nugget there. Depression and bipolar and postpartum depression and postpartum, disturbance really does occur on a continuum. And, at the one end is the kind of stuckness, and at the other end is when, you're really struggling and, you're thinking, do you need to be admitted? Do you need all of these types of things?
Life functioning is
That's
actually
right.
completely impaired.
Yeah. And a question is, at what point do you go to therapy? We've talked to basically at any point.
Yeah.
And I think another thing to kind of touch on is that, not every style of therapy is also going to, suit everyone, isn't it?
Exactly.
And there's different types of forms for all of those mood disorders.
Yeah.
Yeah. When you come in the door, treatment is kind of targeted and tailored to where you're at. So, when you are at this end of the spectrum, when you are going to need more support, we are probably going to be more structured because it's about keeping you safe, versus at the other end where it's more around problem solving, encouraging, and both sitting in that place where you're uncomfortable.
Exactly.
The kind of philosophy behind our clinic is that we wanted to use only the evidence-based treatments for the spectrum of mood disorders, but alongside that we wanted to really be transparent around the types of therapists we were. And watching this video, I think it's quite clear that Erin and I are very passionate about this area, but we have our stylistic differences as well, which is why we paired up together. But we're really firm advocates that if one therapist doesn't fit for you, there will be another one that does, and that doesn't mean that therapy doesn't work. It just means it's not a good fit.
Exactly. Regardless of where you sit on that spectrum of symptoms or severities or diagnoses, seek help somehow.
Absolutely.
If you need it, and make sure that that therapist that you seek out is going to be able to help you with the stuck feeling and you're not really sure exactly what that is, all the way to the end of really severe, just out of hospital or just about to go into hospital, and that therapist can follow you along and build that relationship with you.
Yeah. All right. See you soon, guys.